I want to thank you for joining me this morning, at least this morning out in San Francisco. We'll spend the next, probably 45 minutes together going through IBI's new benchmarking program and how our supplier members can maximize the value of the program in working with clients. So let's begin with an overview. And I want to talk about 6 topics today. First of all, what's in the database, and particularly what are the new features this year in the program. Also, who gets access and how is that access developed. Next, reporting structure. What do the reports look like? We'll do a little bit of review of the pieces of the report, and I think most importantly for the conversation. How can our supplier members most effectively use these reports for their clients? And at the end of the webinar, we'll open it back up for questions and answers. If you have any, I have muted the call-in feature so that we won't disturb the recording that we're doing today. We will put this recording on our website for your colleagues that couldn't make it today. So let's start with a brief overview of the database. As many of you know who have been with IBI for a while, the benchmarking program focuses on 4 benefits programs: short-term disability, long-term disability, family and medical leave at the federal level, and workers' compensation. So this year, the 2011 calendar year experience, and when I talk about calendar year experience, I'm really referring to any claim activity that occurred during the calendar year, regardless of claim inception date. So it really captures all claim activity during the calendar year, even if those claims were filed in previous years. In this year's database, we actually have the biggest database we have ever built at IBI, with more than 62,000 employers in the database, about 3.5 million claims. And we collect data from our data consortium companies at the claim level, which allows us to roll this up to the employer level and then roll the data up to the industry level at the SIC code base. So as you can see here, we have more than 950 individual SIC codes in the benchmarking program this year, which allows us to go from the 1-digit down to the 4-digit SIC codes in many places. And actually the listing of the SIC codes in the database, that listing is available from IBI. So as you can see, in those 4 programs, we show you the number of employers in each program. And as you see here, we have certainly more employers in some programs than other programs. But in each of these programs, we have more employers this year than we've ever had before. And on the right side, you can see the number of claims associated with each of those programs. So a very rich and deep database that we have available. In fact, IBI really is the only place now that has data on all these programs in one place for our members. And these are the companies that provide us all that data, and we certainly could not be successful in this program without our data consortium members. Aetna, Anthem WellPoint, Aon Hewitt, Liberty Mutual, RSLI Matrix, Sedgwick CMS, The Hartford, Broadspire, Cigna, Standard, the Reed Group, MetLife, and Prudential. So these are the companies that provide to IBI all that data that allows us to bring these benchmarking reports to our members, and I certainly want to thank them for their cooperation and their commitment. So new features this year. Every year we've had the program, we try to build in new features, and this year there are a number of new features. First of all, in our query tool that's available to our stakeholder members, we have new elements that our stakeholders can query upon to actually slice and dice the data in ways that most fit their needs in working with clients. Secondly, we have added state-level information for short-term disability, long-term disability, and family medical leave this year. Previously, we've had state-level information for workers' comp. So now we're able to really get down into more regional analysis of benchmarks, and a lot of our members really like to see what's going on in regions of the country. we have completely redone the family medical leave metrics, and we will have a webinar soon around the new metrics and around the new reporting. We have added claims year analysis for workers' comp, and as we all know, or most of us know, that workers' comp really focuses on a claims year analysis and not a calendar year analysis, and we've added that feature to the program this year. And finally, we do specialized analysis by request. One of the reasons that we have built these databases at the claims level is it really gives us tremendous power in looking deeply into the issues important to our members. So we do specialized analysis for individual members on a request basis. So let me just talk a bit about access to the information. And as many of you know, we have 4 different types of supplier members. Our stakeholder members have online reporting for all industries, all the reports available for each of the 4 benefit programs for all the industries in the database. And our stakeholders have access to our database query tool. Our charter members have online reporting access to all the industries and all the reports. And this is where there is a change in availability by membership status. Associates get copies of all SIC Division 1 reports plus 10 individual industries at their choosing. And for each of those industries, they receive all 4 program reports. And our affiliates get access to 5 industry reports for, again, all those programs that they're choosing. So our members on the call, in these various membership categories, you get a sense of what's available to you, and we will be communicating with you with regard to getting access to the information. For our members, our stakeholder and charter members that have online reporting access, I want to just give you a quick overview of the online reporting structure. So when a member logs into the IBI website and enters the user ID and password, there's a button on the right side of our main page which says IBI benchmarking. You click on that button and here's what comes up. And as you can see here, the benefit programs for which we have data are listed here. And at the top we have industry summaries. And so this allows the user who has online access to click on one of the programs and actually start getting access to the benchmarking data. Now you'll see here also group health listed. We have a special relationship with an organization now called Truman, which is the old MedStat Thomson Reuters organization. And through IBI, there is access to the market scan disease profiler for our online member access as well. The second part of access, when a company chooses a benefit program, let's say short-term disability, they start to see here the listing of the industry at the 1-digit SIC code. And this allows them access to the reporting structure. And I won't go through the details here. I just wanted to make sure those members are familiar. So really 4 very basic and easy steps to get access to benchmarking reports. Select the basis for the metrics calculation, whether you want to look at metrics by employer or look at metrics by claim. Employer metrics tend to be focused on incidence. Claim metrics tend to be focused on cost and duration. Second, whether the user wants the report as a PDF or as an Excel spreadsheet. Third, what is the report that you're looking for? So here we've selected all employers, but when we select an industry, you'll start then to see all the different subgroups within that industry pop up where you can actually select the reports within that broad industry group. And the 4th step is simply to download the report to your computer. So a very easy point-and-click structure for our online reporting, but I did want to give you an overview of that. The lost time programs are all structured the same way: workers' comp, long-term disability, and federal FMLA. So let's kind of give you an overview of the report. As I mentioned just previously, there are 2 different views of benchmarks. One is the employer view, looks at everything at the employer level. And typically we like to tell our members that the employer view is really best suited for looking at measures of incidence because it looks at things across all employees. When we're interested in measures of claims costs, measures of duration, and the like, we really focus on the claims view. And so when an online user, and actually when you get any report, you'll see the two different views, and it's very important to understand the differences. And that's really the guidance we give our members. If you want to look at incidence, look at the employer view. If you want to look at costs and durations, look at the claim view. And in the report itself, as we'll see in a minute, we've organized the metrics around the key questions important to employers. And they're really four basic questions. First of all, how well is the program working? And those are measures of incidence. Secondly, how severe are the cases? And those are measures of cost. Third, how much lost work time is generated in the program? And those are, of course, absence metrics. And fourth, how successful is return to work? And that's really based on measures of the maximum benefit duration in each program. We also provide in the report results by plan type in disability. Obviously, in disability, two key features very important to employers, and we'll look at this in a minute, are plan type and diagnosis influencing disability experience. As you see here, we have diagnostic information, and then in the report we have a glossary of terminology and how the individual metrics are calculated. So let's get into some of the pieces of the report, and then we'll talk about how best to use the report with clients. So this is simply a screenshot of our STD report for all employers. And as you can see, we've organized this by the key questions that I just mentioned, and show for each question the metrics available to answer those questions. So as you can see here, for each of the key questions for each metric, we have a number of different statistics that we calculate. And I hate to use that term statistics, but in fact that's what this stuff is. And we'll talk about how to use it in a minute, but I want to give you an overview of what the report looks like, and then we'll talk about how to use this information practically with your clients. So for each metric we show the group average, that is the arithmetic mean. We also show next to that the group median. And the group median is defined as the 50th percentile, that value that divides the group into two equal parts. And oftentimes you see the mean and median, the average and the median, as very different numbers. And let's take as an example, let's say look at payments per closed claim. So the average is about $4,500, but the median is about $2,300. Now what that tells you is that there are a lot of cases on the high end of this metric, because the average accounts for all cases, and very expensive cases influence the average in a way they don't influence the median, because again the median divides the cases into two equal parts. So this is a very good example of how different the average can be from the median. We also show some more information about the distribution, how the cases line up for this particular metric. The 10th percentile, that is, this is the percentile where 90% of the employers have a value higher than that percentile. And if you can probably remember back from your SAT days in high school, you are ordered by percentile. And so these things tell you where an individual value fits in the context of the other values. The 25th percentile, 75% of the employers have higher values than this. The 75th, 25%, excuse me, I said 75% have higher values than the 25th percentile, and 25% have higher values than the 75th percentile. And the 90th percentile means, of course, that only 10% of the employers have higher values than that. So it gives you a sense, particularly working with a client, about where things fall on the spectrum of the results for that particular metric. We also show for each metric the number of employers that went into the calculation and the number of claims. We also show the median value for all the employers in the program, just for the sake of context. Now let's look at the second part of the report, the plan design dimensions. What we've done here, because of the way we get the data at the claim level, it allows us to essentially aggregate experience by plan design. And we actually use the data to essentially create categories of plan types. And as you can see here, categories from Plan A through Plan I. And there are two features that define the plan type: the elimination period and the maximum duration of benefits. So you can see here the different types of plans that are found for STD across all the employers in the group based on the elimination period and the duration of benefits. And we also show what percent of the employers are accessing that plan type. So it really gives you a sense of what's going on, particularly when you're looking at a specific industry group, what's going on in that industry with regard to plan type. The number of employers on each of those plan types, the percent of employers with the plan type, etc. Now, as you can see these numbers, they will often add up to more than 100% because employers often have more than one plan type in operation within their company. And the third piece in the STD report is diagnosis. As you can see here, we've taken a screenshot from an employer report showing an individual company. You know, this employer, or this is a sample report. So employers have the option of giving us their diagnostic information, which allows us to show how they compare from a diagnosis standpoint to the industry. But from the standpoint of the industry reports, this is the information that you would see. So for each of the major diagnostic classes, MDCs, we show the percent of closed claim for that MDC, the percent of payments for the closed claim, because incidence is often different than cost, and the lost calendar days per closed claim, both the mean value and the median value. So these two features, these last two features, really give a great deal of information about what underlies experience, plan type, and diagnosis. Now let's focus on using reports with employers, because after all, that's what the data are most useful for. And we really see this, the use of the benchmarking reports, really in two different ways. And we find from our members, our supplier members, that they use the reports in different ways, depending on whether they're talking to a prospect or a new client, and they don't have the client's experience data readily available, or whether they're talking to a current client that has experience data. So from the standpoint of a prospect or a new client, the reports really serve two primary purposes. One, industry intelligence. It allows our member to walk in to talk to a prospect or a client and be able to say, let me tell you what's going on in your industry with regard to the benefit program in which you're interested. Plan design features, diagnosis, typical results for the industry. So it really allows you to add value to that organization, that employer, just by getting access to the report, because not all of the organizations out there that work with employers have access to this information. But it also allows you to talk to that employer about potential savings opportunities. Now you're going to make some assumptions about where the employer is today and what they might achieve. But by using the data in the report, it really allows you to talk from an empirical standpoint to that employer using industry data. So it really allows you to engage that employer in a discussion about their experience, tapping into the industry data available to you in the benchmarking reports. And of course, the second opportunity is to work with a client that actually has their data. Now again, you can bring that client industry intelligence, plan design, diagnosis. But now you can really talk to that client about real savings opportunities, because you can start with their experience and then talk about what they might achieve and what savings would flow from achieving different levels in their experience. Now let's look at that industry intelligence part. And so what I've done is I've gone into the all-employer report and just put a couple of graphs together. And for anyone on the phone that would like copies of these graphs as templates that you can then use and put in actual industry-specific data, please let us know. I will be happy to share that with you. So let's look at plan design. And as you can see here, it's pretty simple, straightforward graphic, just taking the basic plan designs and showing what percent of the employers in the industry have implemented that plan design. As you can see here, this adds up to more than 100% because we have multiple employers with more than one plan type. But it's a very nice way to take what is tabular data and display it in a nice, simple, straightforward graph and talk to a client about what kinds of plans are in operation in your industry. What's typical? Same thing with diagnosis. By tapping into the diagnosis information in the report, we can start to look at the distribution by way of prevalence of different diagnoses. So in fact, the top 10 diagnoses for this industry account for 92% of all the conditions. So it allows you to really bring to that employer information on plan design, information on diagnosis in the industry to start to help that employer think about where they are, what they might do, and what kinds of things would influence their experience they perhaps can control or perhaps have a more difficult time controlling. Obviously, plan design is much more easily controlled than diagnosis. But I think the diagnostic information helps the employer think about disease management, care management programs, and the like as they might affect the disability experience. And then the third area is looking at diagnosis by lost time. And of course, what jumps out so quickly is there's tremendous variation in lost time for closed claims around different diagnoses. So we see on the low end about 41 days for digestive systems. On the high end, we have musculoskeletal issues, mental disorders, and neoplasms. So again, information very quickly allowing you to talk to employers about the influence of diagnosis on the lost time that they're responsible for in managing their program. So let's look at perhaps what's the most important part in working with a client, and certainly what employers are most interested in, which is identifying opportunities for improvement using benchmark data. Now, in any savings opportunity analysis, the first thing we have to do is select the starting point. Where are you today? Now, that may be an estimated point when it's a new prospect or a new client, or the actual point when you have experience. The second part is selecting a target level for improvement. Is it a 10% reduction? Is it the median value? So you need to decide how we're going to select that target value that's a reasonable value. Third, of course, is then to calculate potential savings. So what I'd like to do is use two examples from our STD report. One is the impact of reducing claims incidence, and the other is reducing impact in average claims duration. So let's start with claims incidence. And if you think back to the way that report looked, what I've done is I've taken the two key features, one looking at the actual statistics here, and then I've selected a metric, new claims per 100 covered lives, as a good metric for incidence. But oftentimes we find, and those of us at IBI that work with data all the time, looking at distributions and percentiles, this is kind of what we do. But we often find that our members aren't often comfortable in looking at data this way. So what we've tried to do here is let's bring this information down into a way that kind of makes more sense. And so what we've done is just taken the percentile information and displayed it on a simple straight line from lower incidence to higher incidence. And you start to get a feel for how this looks. Just the experience of the employers in this data set by way of lower to higher incidence using real numbers that we find up here. And again, one claim per 100, 90% of the employers in the industry have higher claim rates than that. The median value of 5, that tells us that half the employers have an incidence of above 5, half the employers have an incidence below 5. And up on the upper extreme, 12.5, only 10% of the employers have an incidence more than 12.5. And then we put the mean value, the 6.4, in the context. So it's a very nice way, and just this kind of graph in talking to an employer is a very easy way to visualize what experience means. And I'm willing to bet that it's easier to use this kind of graphic perhaps in talking to an employer, than that kind of graphic. So this is a great starting point in starting to talk to an employer about what's going on in your industry, what's experience look like. Now let's talk about improvement. So we'll use, again, what the exhibit that we just had, that graphic showing from lower incidence to higher incidence. And now let's say we're going to be working with a new client or a prospect that you don't have really any information on, and perhaps that employer itself doesn't have information on their experience in short-term disability. So the first step, as I said, is let's assume typical experience in the industry for that employer. And let's select the average for the employer as that typical experience. And as we see from the report, that average is 6.4 claims per 100 covered lives. That's the starting point. So in working with a client or prospect, don't have any information, let's just, as an illustration, say that your claims rate is 6.4. And as a second step, let's select a target for improvement. Now, I've selected the median value. Now you could argue that that difference perhaps is quite large, and it really is up to you in working with a client to select a target value that you think makes sense, either based on your knowledge of the industry or perhaps based on the conversation you've just had with that employer. So the industry median here is 5.0 claims per 100 covered lives. And now we want to calculate the difference, the impact. What savings could come to that employer from moving from 6.4 claims per 100 to 5.0? So let's assume for this particular discussion we're working with a 10,000 life manufacturing company. So that typical experience of 6.4 claims per 100 translates into 640 new claims per year. The target experience of 5.0 claims per 100 translates into 500 claims per year. What that, of course, means is a reduction in 140 claims. Now, of course, what we want to do is translate that 140 claims into savings. Well, in the industry report, we do have a metric which is average claim cost for closed claims. And in this case, it was $4,526 for the employers in the STD program. So the projected savings is pretty simple math, 140 claims that you no longer have to deal with, times $4,526 by way of average claim costs, and so we're looking at $633,000 or so in savings. Now, the key here is the process in selecting that starting point, selecting the target, and then doing the math. But the point I want to emphasize is you can use the information in the benchmarking report to set all this stuff and actually make these calculations. And once you do it, then it's very straightforward once you get to this point. And you can talk to the employer about, well, what if you reach this target or that target, and redo the calculations and do a nice little spreadsheet on different starting points and different ending points and what that would mean financially and how you might help that employer. Now, when you have a client with information, of course, it's more straightforward because you know what the starting point is. And perhaps it's even more straightforward because you might have experience with that employer. You have a better way of really estimating what a good target and a reasonable target might be. And then the math is the same. So it's very easy, I think, to do this. In fact, if you actually have the average claim cost for that employer, you can substitute that for the industry rate. So having information about an individual employer allows you to use the same process and use data that's most applicable to that company. So let's give an example for claims duration. Again, we see the same kind of setup I've drawn from the industry report, the average, median, the percentiles, and then again shown the straight line from shorter durations to longer durations. And we'll again grab that information and bring it right into that nice straight line and start to illustrate and visualize what this looked like. Now, I think what's interesting about duration, and one thing that a graphic can do that perhaps numbers like this can't do if you don't use them a lot, is you start to see that big gap between the 75th percentile and the 90th percentile. So it really helps you visualize for this industry group what's going on and how bunched up the employers are in their experience or how widespread the experience is. Now, let's go through that calculation process again. And again, a client where you don't have data, we'll select the typical experience. The average for the industry, 36.1 days per claim. Reasonable starting point. Second, of course, is now we select a target value for improvement. I've selected the median here, and you might argue that moving, in this case, from the mean to the median, which is a reduction of 10 days per claim, is a huge leap. And that's not important. What's important is the process. So it's very important that you choose a target that is reasonable based on your experience, the industry, or whatever. I've just used the mean and the median as just two illustrations here of how to do the process, if you will. And then we again calculate lost work time. So 10,000 life manufacturing company, 640 claims. For those 640 claims, 36.1 days per claim, a total of 23,104 lost work days. So the math is simple multiplication. Again, taking the estimate at the mean, 640 claims times 26 days, 16,400 days in lost work time, or a difference of about 6,700 lost days. We have the average claim cost. We translate that into a daily fee just by doing the math again, $125 a day in benefit payments. And again, we do the projected savings opportunities, $125 a day times 6,700 lost days, about $840,000. So again, it doesn't really matter from the standpoint of the illustration what you select by way of the target or the result. There's information in the report that can actually help you do this math and present to the employer what is reasonable given industry data. Now, what I haven't gone into here is the combination of the two. If you had improved incidence and at the same time improved duration, and again, that math again is very straightforward and based on the same process that you see here. But two illustrations of how you can take data from the benchmarking report and start to bring it home and make it real for an individual employer in their industry, whether they have information readily available or they don't. Now, from the opportunity standpoint, as I mentioned, we are recording this webinar. We're going to put it on our website. For your colleagues that didn't have an opportunity to attend today, by all means, send them to the website. It'll really give them a very quick overview to what's available, how to access it, and how to use it. For your colleagues that would like to have access to the benchmarking information, it does take a user ID and password, but our memberships are corporate, so all of the colleagues in your organization have the very same access to the benchmarking data. We certainly would like to and want to work with you and individual clients to do benchmarking studies where IBI plays the partner role of getting the data from the employer, generating the report, providing it back to both of you to help facilitate the conversation. IBI is always available to you, our supplier members, to answer questions about a benchmarking report, whether it's an industry report or an individual report for an employer. I think one of the real powerful opportunities, many of our supplier members work with industry groups. That is, they have a number of employers in the same industry. It's really a perfect setup to do an industry benchmarking study where we work with all the employers in the group, collect their data, give back individual reports, and then the member facilitates a discussion with those employers about what's going on, what works, where you are, all those things. And so it really allows, I think, an additional value to working with multiple employers in the same industry that share experience and are going to share what seems to be working. As I mentioned, there's always available more detailed analysis from the database to our members. When a benchmarking report or for our stakeholders, the query tool does not exactly get at the question you have, you can always work with IBI staff to actually do the analysis to generate those reports and help you really focus on those questions. I will say that that time is based on fee-for-service, but we typically can do that work in as few as several hours. So it's not an expensive undertaking, but it really allows us to maximize the value of the data to you and to your clients. Now, for more information about the program or working with